Afternoon. Welcome to the Thurston County Board of Health meeting for Tuesday, September 14th, 2021. It is 3:44 p.m. My name is Ty Menser, Chair of the Board of Health. We have Vice Chair Carolina Mejia, Commissioner Carolina Mejia, and Commissioner Gary Edwards present, as well as our County Manager Mira Chavez, our Administrator for our Board of Health, our Director of Public Health and Social Services, Shelley Slaughter, our County Health Officer, I believe is here, Dr. Abdulmalik, and several guests that we will get to at the appropriate moments. So calling this meeting to order, and we need to look at the proposed agenda for today. Is there a motion, Vice Chair, for regarding the proposed agenda?
I would move to approve. 1 second. I'm sorry. Wrong agenda. Thank you. I would move to approve the agenda.
Is there a second?
It doesn't have a date.
Oh, okay.
Sorry, we're a little convoluted over here.
Okay.
Okay. So it's for the agenda, right?
I heard a motion to
the
approve the
agenda.
proposed agenda. I was looking for a second.
Yeah, I didn't have my mic on. Second.
Okay, moved and second. Call for the vote.
Commissioner Mejia,
Aye.
Commissioner Edwards,
Aye.
Commissioner Menser,
Aye, motion carries. Agenda is approved. Is there a motion regarding approval of meeting minutes from August 10th?
I would move to approve the meeting minutes from August 10th, 2021.
Second.
It's been moved and seconded. I'll call for the vote.
Commissioner Mejia,
Aye.
Commissioner Edwards,
Aye.
Commissioner Menser.
Aye, that motion carries unanimously. Next up is two proclamations this month. The first is a proclamation for Suicide Prevention Awareness Month. Marianne O'Garo, Senior Epidemiologist of our Public Health Department, is here to give an overview of this proclamation. Go ahead, Marianne.
Thank you very much for hearing this proclamation and for hearing some of our guests today that are present. For Suicide Prevention Awareness Month, one of the things I'm pleased is your interest in this proclamation and for proclaiming September Suicide Prevention Awareness Month, and in doing that, acknowledging that many people in our community and in Thurston County think about suicide. That is not something that is it's something that helps us prevent stigma by acknowledging the fact that many people contemplate suicide. And one of the ways to prevent suicide is to talk about suicide and to acknowledge the fact that there is something that we can do around this particular area by openly and directly addressing this particular area of health and well-being and dispelling myths. And the proclamation that you have in front of you addresses a whole range of very specific things that are actions that we can take as a community, and specifically things that you are encouraging others in our community to do. And in highlighting this particular area of importance, one of the things that you're proclaiming is that suicide prevention is a priority. And in sharing with you today some of the guests that we brought to receive the proclamation, I wanted to put a little background in there that goes along with this particular proclamation. We highlight a few things, one of which is a training that we've been working extremely hard on bringing more of to Thurston County, and that's Question, Persuade, Refer training for Thurston County. This particular training, QPR for short, is referenced in one of the bullets. There are several highly evidence-based trainings that help prevent suicide and save lives. But this particular one, in fact, was actually shared with our department and Thurston Youth Alive, which is sponsored by Thurston Thrives by the Skokomish tribe of Mason County, as something that they thought was something that was highly recommended. They shared it with us, and it's something that we've worked very hard to bring to Thurston County. And several of the people in front of you are QPR trainers. Some have been doing this for some time. Scott Hanauer was
Oh,
trained.
yeah, I think so, unless it's been
Was
changed.
trained, and several other individuals were recently trained. And we wanted to share that with you because what this particular training does is provide 90 minutes of an opportunity for people from communities. You do not have to have a clinical license, have any mental health training, but it provides you special opportunities to reach your community and help people identify the warning signs so you can help your family, friends, and neighbors. And we wanted to acknowledge those folks who are making a difference in their own communities, and family education and support services like some other nonprofits who are stepping up to the plate and really making a difference. And if it's okay with you, we'd like to introduce to you some of our PPR trainers in our community who are making really some strides in our community with suicide prevention, if that's okay.
Yes, please, go ahead.
Scott Hanauer, is that okay? Clinical Director of Family Education and Support Services.
Thank you. And I'd like to introduce a number of other people from Family Education and Support Services that are trained in QPR suicide prevention training. Rosa Venancio, Kyoki Kananoy, and Jody Smetak, and the Executive Director of Family Education and Support Services is Shelley Willis. We started Thurston Youth Alive about 3 years ago, and it what got our attention was that in the spring of 2018, 3 young people died by suicide, and 2 of those kids were 9 years old, and they were not accidents. These were kids that had a plan and had a means. One of the things that, as Marianne mentioned, our task force was able to do is to get a grant to do QPR suicide prevention training. Just since the beginning of this year, we've trained more than 650 people in our region in suicide prevention training. And one of the things that we've learned is that suicide is really very close to a lot of people in their families, their extended families, their neighborhoods, and particularly in their schools. One of the things that we have accomplished just recently is to certify about 20 more people to do QPR suicide prevention training. And those people are from communities that we know are high risk for suicide. One of the things that we're very excited about is that a group of counselors at North Thurston, from the North Thurston School District, are now trained in suicide prevention, and River Ridge High School has taken on training high school youth in suicide prevention this fall. And that's always been kind of a dream of ours, is to train young people, because they oftentimes know who in their community, who in their school, and who in their neighborhood is at risk before adults do. So again, thank you very much.
Thanks, Scott.
And in terms of people who have been trained, as Mr. Hanauer shared, we've also were this spring able to train additionally 2 individuals who have connections with military active duty residents of our community, and that has always been a concern for higher risk, but also there are some impacts related to Afghanistan, deployments, different impacts in our community, both also our youth whose parents have been in that region. And so we were able to connect that, and we continue working forward. And just really thank you, because as you see in the proclamation, unfortunately, this is a leading cause of death for groups in our community, and we thank you for taking the step forward to constantly put this forward as a priority a high priority in our community, and allowing us to put resources consistently to address this area and work with our partners, including others mentioned here who are doing wonderful work in this community to address stigma and provide resources to our residents. So thank you.
Thank you, Marianne. Thank you, Keoki and Rosa, Jody, Shelley for being here. Anything, any of you, I'll give you the floor if there anything any of you wants to add to what we've already heard.
I would like to add one thing. In our presentation, we talk about how the national suicide rate has elevated by 30%. In our state alone, our suicide rate is 11% above that. Within the LGBTQ community, the suicide rate is even higher. But one of the things that we have learned is for children who are transgender or non-binary, simply accepting their pronouns cuts their risk of suicide by half. And just having that awareness put out in the community has made a difference, I believe, for our children. And I want to thank everybody who's a part of that. And I want to thank the Thurston County Commissioners for this proclamation. Thank you.
Go ahead, Shelley.
I'd like to thank Marianne O'Garo for her leadership and Shelley Sauter for leadership at the Health Department, giving us the arena to participate. Scott Hanauer, Jody, and Rosa for taking on leadership and presenting it for this community. Truly took a village, and just want to thank you for your leadership.
Okay. Great. Commissioners, any questions or thoughts before we go to the proclamation?
Oh,
Go ahead.
by any chance, were we going to hear from Gary Warnock's office?
Shelley, did you say you had some stats for that? I know Gary couldn't.
I thought that's what I heard, yeah.
Oh, is that?
Yes. Unfortunately, our county coroner, Gary Warnock, was not able to participate today, but he did provide me with Thurston County's most recent suicide statistics, and I'll share those with you now. In 2018, 46 people committed suicide. In 2019, that went up to 50. 2020, that went up to 52. And here we are in 2021. And as of August, only about halfway into the year, and we are already at 29 people who have taken their own lives. So we are very concerned about this increase in suicides here in Thurston County. And after the year is complete, we hope that we won't see that number increase, but our county coroner, Gary Warnock, will be back to share a briefing with the board in terms of our 2021 statistics.
Thank you.
Okay. Just one comment I have is just one of the statistics that has been the most alarming to me as a commissioner that I've seen came from in this area. And it was, I think it generated by our public health department, and it related to percentage of like middle school age Thurston County students who have suicidal ideation or thoughts. And the number is just unbelievable. I mean, truly, like I'm not exaggerating, literally unbelievable to me. But I've seen it backed up in other places. So I now believe that it's true, which is a reason why, you know, we need to do things like this and continue the trainings that the folks at FES are working on. Commissioner Mejia, we're ready for the proclamation, I believe.
Perfect. I want to thank Family Education and Support Services really quick for offering these services out to the community. And you continue to offer these training classes and they continue to be filled up. And it just shows, you know, the need in our community here in Thurston County. And, you know, those statistics, they don't lie. And the need is still there. And, you know, we know it's been aggravated because of the pandemic. And so thank you for continuing to do the hard work. With that, I'm ready to Read the proclamation.
Go
Suicide
ahead.
Prevention Awareness Month. Whereas September is National Suicide Prevention Awareness Month and suicide prevention is a priority in our community. And whereas suicide is the 8th leading cause of death for Thurston County residents and the leading cause of death among county youth aged 10 through 17. And whereas many residents of Thurston County are affected by suicide across the lifespan, some are disproportionately impacted, including youth, veterans, people of color, older adults, and members of the LGBTQ community. And whereas there is no single cause for suicide, there are warning signs that we can learn to recognize and respond to. And whereas talking about suicide does not increase the risk for suicide for youth or adults, and whereas everyone can have a conversation with someone they are concerned about, and whereas taking a community-based class like Question, Persuade, Refer, QPR, or Mental Health First Aid can save a life. And whereas all of us can share the National Suicide Prevention Lifeline, 800-273-8255 number, Línea Nacional de Prevención del Suicidio, 1-888-628-9454, or the local crisis line, number 360-586-2800, and keep it in our phone contact list. And whereas local organizations like Family Education and Support Services, Crisis Clinic of Thurston and Mason counties, the National Alliance on Mental Illness, Thurston, Mason, and many others are working to increase awareness of what can be done to prevent suicide. And whereas demonstrating care and compassion about suicide is something each and every one of us can do. Now, therefore, be it resolved, the Board of Health hereby proclaims September as Suicide Prevention Awareness Month in Thurston County and encourages all residents to save lives and bring hope to those affected by suicide through support for prevention, actively taking time to learn more, sharing resources, and caring for those in our community. Adopted this 14th day of September 2021.
Thank you to all our
No
guests.
audience, though.
I do have a question. When is the next QPR class?
Oh my.
I have it. If you don't, I was ready for that one. One I could share is they do multiple trainings, but I do know that Wednesday, September 22nd at 1 o'clock to 2:30. Honestly, I know you fill up. That is one of the next ones that Family Education and Support Services is offering. Our Public Health and Social Services social media accounts will be posting all of their list of opportunities coming up tomorrow around 10 a.m. so that folks can look at that. They are doing them October, November, and December, along with some other opportunities. So if folks want to look both at that, and that has Family Education and Support Services has, of course, a wonderful website and web page that has that information, and they have a series of dates, 90 minutes, free, no cost, absolutely worth your time. You can learn from this and apply it to your family members, friends, and neighbors.
Can I just mention too that QPR is becoming noticed around the state. We were recently asked to schedule a QPR training for the statewide Attorney General's office, and that will happen on, I think, Tuesday next week. So the opportunity to do it across the state is increasing.
Perfect. Thank you. Let's go to our second proclamation for this meeting, which is the proclamation for SepticSmart Week. Art Starry, Environmental Health Division Director, is here to give us an overview of this one.
Good afternoon, everybody, and Board of Health. And I just want to thank you for the previous item. I actually was able to take a class on mental health first aid last year. It was one of the last things I was able to do in person before the big COVID thing. And it was very helpful and very instrumental as far as trying to, recognize the severity of suicide awareness and the issues within our community. So it's a very worthwhile thing. And I'm glad that the board is focusing some attention on that. So getting to my particular item, which isn't nearly as serious as that, is Septic System Smart Week. And we're asking the board to proclaim September 20th to 24th as Septic Smart Week. And the reason we're asking this is because we have a whole lot of septic systems in Thurston County. There's about 55,000. We actually think the current number is 54,900. And they produce more than 12 million gallons of wastewater a year. And that's about what the Lot wastewater treatment plant down in Olympia produces. And while septic systems do a great job if they're properly designed and installed and maintained, when they fail, they can cause a lot of problems. They can cause public health problems. They've been associated with shellfish downgrades. We've actually been able to trace illness associated with septic system failures in Thurston and Mason County. We've had other issues that are coming on, and also it's really expensive to repair them. If you have a total septic system failure, it can be easily over $15,000. And so what we're doing is asking the board to proclaim next week as Septic System Smart Week. That's something that was started years ago by the Environmental Protection Agency in recognition that there are a lot of things that people can do to make sure that their systems are functioning properly and to protect their investment. The state of Washington is also proclaimed next week as Septic System Smart Week. And so we're asking you to adopt a proclamation to basically facilitate that or to go along with it. And we will attempt to promote that as well, to try to get people to do what they can to monitor and maintain their systems. We do a lot of that in Thurston County, but this measure is a fairly simple one. And it also will kind of amplify the message because the state and others will be helping to try to promote this as well. So we're hoping that by doing this, we can get people to just take a look and see what they find and make sure their systems are maintained. I think as the board may recall, we've had a lot of briefings about septic system stuff and numbers of failures. The one thing that really stood out to me, and I think we've talked about it, is the number of systems or the percentage of on-site systems that have problems, that when they're properly monitored and maintained, even something like 9% of them have significant problems. And so by doing the inspections and taking a look, you can often keep these problems from becoming total failures. And again, that has both public health and financial impacts if the systems totally fail. So that's why we're asking you to proclaim the Septic System Smart Week for next week. And then after this, we'll also have a presentation of some of the work that we're able to do within Thurston County to try to educate and inform people about the right thing to do to maintain their systems. So that's pretty much it. Unfortunately, we don't have anybody else to talk to you about this today. But again, we're hoping that you can adopt the proclamation.
Questions from the board for Art?
No, sir.
No
None?
questions.
Okay, then I'm ready to hear the proclamation.
Okay. Very sexy topic, let me tell you. Septic Smart Week. Whereas it is the mission of Thurston County and Public Health and Social Services to create a community that promotes health, commerce, and environmental protection, and to work with the community to achieve the highest level of health and well-being for everyone. And whereas septic systems that are properly designed, installed, and maintained are vital to protecting public health, our invaluable drinking water, lakes, rivers, streams, Puget Sound, and our shellfish industry, which produces almost 6 million pounds of shellfish each year. And whereas there are 54,900 septic systems in Thurston County that treat and dispose of almost 12 million gallons of sewage per day. And whereas Thurston County's on-site system professionals, environmental health division staff, and community partners use their experience to design, install, maintain, and regulate septic systems, and to provide information and resources to help people properly use and care for their septic systems and avoid costly repairs and fulfill the collective mission of Thurston County and PHSS. And whereas the Environmental Protection Agency and the Governor of the State of Washington have declared September 2024, 20th through the 24th, 2021 as Septic Smart Week to increase awareness and highlight the need for proper septic system maintenance across the state. And now, therefore, the Thurston County Board of Health hereby proclaims the week of September 20th through the 24th, 2021 as Septic Smart Week, and encourage Thurston County septic system owners to learn about their septic systems, and for all residents of Thurston County to join us in this special observance that contributes to a thriving, hopeful, healthy communities where all people are safe and supported by, and our environment is protected. Adopted this 14th day of 2021, of September 2021.
All right. Thank you, Commissioner Mejia.
Thank you.
Thank you, Art. Okay. Back to item 3 on the agenda, which is opportunity for the public to address the Board of Health. I have not been handed a sign-in sheet. Is there somebody in the boardroom? I'll ask the county manager since he's sitting there.
There is nobody in the boardroom, Commissioner.
Okay, and there's nobody on Zoom, unless Shelley would like to testify. Willis.
I'm just here to watch this show. Happy to be here, and thank you for honoring the suicide prevention.
Okay, thank you. And we'll move on to item 4, which is a presentation regarding water quality and on-site sewage system operation and maintenance. Back to Art.
Thank you. So I'm going to quickly hand this off to Vladimir Nekrytenko. Vladimir is an environmental health specialist too in our on-site sewage and maintenance program and water quality program. And he's going to talk about our septic system education and outreach efforts that we focus particularly on Henderson and Nisqually, but also other members of the community are able to participate in this. And so one of the things that we did years ago when the Henderson and Nisqually programs were started, and those are those special monitoring and maintenance programs in the Henderson and Nisqually watershed areas that are designed to help protect our shellfish harvesting areas, is we created a educational program, and this was actually done at the request of an advisory committee that worked with us to develop the requirements for those programs. And what happened is that they wanted to figure out a way so that they could become certified to monitor and maintain their septic systems, to protect their investments, and to avoid having to necessarily hire a professional to do the inspections for them. And so we set up the program, and it has worked like gangbusters. We thought it would be poorly attended. We did it, but we set it up because that's what the public wanted. Well, over the past several years, there's been more than 3,000 people who've attended the class. And most of them have attended the 6-hour in-person class. And part of the reason our classes are really successful is the ability of our people our staff to put on an educational program that's very entertaining and informative. And someone named Dave Tipton started it years ago, but now Vladimir has taken over the reins and is doing a really good job. And over the past year, not only has he had to figure out how to teach the class, but also how to adapt it because of our COVID stuff, because we've wanted to continue to provide those services, but also do it in a safe way. And so he's here to talk about the class and kind of what we try to provide, the information we try to provide, and how it's been modified a bit over the past year in order to accommodate people during the pandemic. And so without any further discussion, I'll just turn things over to Vladimir, who, at least on my screen, has got the bottom center block. So take it over, Vladimir.
Good afternoon, everyone, and thank you for having me today. I will go ahead and share the screen for a short presentation with a lot of great visuals. Just one moment. Oh boy. Okay. There we go. All righty. Thank you for your introduction. My name is Vladimir Nekrytenko. I'll go shortly by Vlad. It is my pleasure to talk to you.
Hey, Vlad, we've got looks like you're doing a permit review. You've pulled up a different screen than the slides.
It did? Okay. Apologies.
I was going to say,
you're working right up to the last minute before the presentation.
I was going to say his idea of a great visual and mine are a little different.
Apologies for the technical difficulties. All right, are we good?
We're good to go.
Okay, awesome. Thank you. Thank you so much. I apologize for that. It is my pleasure to talk to you today about one of my favorite parts of the job is homeowners septic inspection certification class. So just like Art mentioned earlier, that in early 2000, Thurston County determined Henderson Inlet being a part of the marine recovery area due to the high bacteria levels in Puget Sound. Later on, Nisqually Inlet has joined the marine recovery area as well. And it is Thurston County requirement that all of the septic systems within the marine recovery areas is inspected at least once every 3 years. And since early 2000s, that's when we started offering this septic inspection certification program to all of our to the homeowners of the marine recovery area. So instead of hiring a third party, just like Art mentioned, the homeowners now have an opportunity to conduct the inspections on their own completely independently without spending enormous amount of money for maintenance and of their septic system. So this is a great opportunity to reach out to the Thurston County residents and educate them about the importance of septic system maintenance and proper operation, and let those residents to participate, improving the water quality of Puget Sound and other bodies of water in Thurston County. So in this class, we do go over basics of septic systems and its components. Why is it important to take care of our septic systems, and how a failed septic system can cause a closure of local shellfish harvest. We also talk about signs of septic failures as shown on this image. What looks like a puddle is actually surfacing sewage, which is a great hazard to public health. We also talk about how to inspect the septic tanks and pump chambers, which is not as bad as it's shown on the picture, I assure you. And also we talk about how to inspect the drain fields. So initially, the classes were held once a month in Lily Road building, alternating Fridays and Saturdays to accommodate our residents and their schedules. It was a 6-hour class going into detail over the septic systems and how to inspect them, including a short field portion that was taking place in the septic park at the top of the parking lot of Lily Road complex. And it was up to 30 people in the group due to the size of the room that we were able to provide. But in 2020, that's whenever we got hit by the COVID-19 pandemic. A lot of classes got canceled. And until the summer of 2020, when we came up with a new format, which has taken place outdoor at our septic park, with a maximum of 9 people, following the mandates and ordinance related to COVID-19 safety. All participants will be outside of the fence, maintaining social distance and masking mandates. Basically, we were able to shorten the class to 2 hours and held it twice a month, once on Friday and once on Saturday. However, as we went closer to in November of 2020 into the colder and wetter season, we had to stop holding those classes because it was just too cold and too wet to keep people too long outdoors, really. So we start working on our new and now the current format. So the participants will sign up for the class, and then they would watch educational lecture videos from Department of Health webpage, the links to which that we provide. After that, the attendees are required to pass Thurston County test, and then they would schedule a short 30-45 minute field session with me, the instructor. This gives them an opportunity, it gives me an opportunity to provide further guidelines about Thurston County requirements versus state requirements, ensure that the homeowner have understanding of septic systems, and give them an opportunity to ask them questions if they have any. The field portion is offered every Friday for small groups of people. At this point of time, the maximum amount that I've had in one session was 7, but I still like to keep it under 12 for the COVID-19 safety reasons. At this point in time, we're planning to continue to keep the current model of COVID-19, due to the COVID-19 safety aspects. But the future does look very bright from this point on. As we recover from the pandemic, we're looking forward to start in-person class again, potentially for initial training, and then utilize the web resources potentially as a refresher. But most importantly, me and the rest of my team are looking forward to have this program be available to the residents outside of the marine recovery area. So pretty much everybody in Thurston County. This will increase our outreach and education opportunities. The level of people awareness when it comes to septic systems and maintenance is quite low for obvious reasons. It's out of sight, out of mind. And it is a nationwide issue, as a matter of fact. And I believe that this class and the homeownership program, certification program, is a great opportunity for us to come together as one county and preserve and sustain the majestic and beautiful environment and habitat of Pacific Northwest, and specifically the water quality of Puget Sound and other bodies of water of Thurston County. Thank you so much.
Thanks, Vlad. Questions from the board, Commissioner Edwards?
No, I just think that was a good presentation. Glad, very good.
Commissioner Mejia?
No, just a comment. Props, to adapting under the circumstances that you were in. You can see that, you've adapted pre-COVID and to COVID, and now where we're at. So, props to you.
This is a question that, Vlad, if you don't know, maybe Art does, but I'm just trying to get a sense of the 54,900 systems, and this is only available, from what I understood, to the marine recovery areas. How many systems are within those marine recovery areas that would be, and you said 3,000 people have taken the class. I'm trying to get a sense of what percentage of the people that could have taken it maybe did take it.
I can help on that if you'd like, Vlad. We've got about 11,500 people or septic systems within Henderson and Nisqually. That's a rough estimate. I don't have the exact number. So if you, sometimes there'll be more than one person from a family that attends, but that's still a really high percentage of I think of the community that's out there that's taken this over time. It's, I think, quite a testament to the effectiveness of the class.
So if a quarter are taking it, let's just say, and we expanded it to all 55,000, then you might have to give 10,000 classes, or is that the idea? Maybe if there was the same level of interest, 12,000 people might step up to take this.
So that's one of the challenges and that we've talked about in our briefings. Is this is something that our advisory committee has recommended that we offer this to more people and that this high level of training. And then the question is, how do you go about having enough staff to do it? And then also, is there a way like what Vlad and our staff have worked on to make it more efficient? I won't say more efficient, but being able to use online technology and stuff to basically open the door to more people. So we're working on that, but that's also part of the discussion that we're having about, are there ways to provide more resources to do this? I don't, who knows how many would do it, but I think it is a valuable service. And I think Vlad can attest to this. We have really positive interactions with the staff. I know that often we talk about how we're kind of seems at times that we're at odds with the public or the public doesn't trust us. Well, this is something where, for whatever reason, and I think it maybe Vlad's enthusiasm that he showed here and the enthusiasm of our other instructors has really helped turn the tide as far as having positive interactions with the public. And so I think there's a lot of benefits to it. But if we were to offer this to not all 50,000 people would be able to take advantage of this, because some systems are just too complex to learn to do on your own. But if there's, say, 30,000 people who suddenly are eligible for this, that would be quite an undertaking. We admit that.
Is there a fee for the class, or is it?
It's covered by the Henderson and Nisqually fees that they pay. So it's part of the services that they've paid for. We've also been able to offer it to a few other areas using grant funds. So in Eld Inlet and some other areas where we've had some concerns in an attempt to try to work with people to provide a higher level or to achieve a higher level of monitoring and maintenance for septic systems. We've offered this class and some other incentives, and we've been able to improve conditions. Improve the inspection rates a little bit, not as much as we'd like, but we have offered it elsewhere, but it's primarily Henderson and Nisqually.
Any other questions from the board before we close this piece?
I would have a question, but I'm not sure it's for Glad or Art, or maybe it doesn't apply at this point, but how are we coming over there on that camping club?
We are working on it.
Does Glad put on programs over there for them as well, or?
They're able to come to that class. They're within that area. In short, though, what we're doing is we're working with, you'll probably see a grant amendment or a project grant amendment in the future that will allow us to more time to work with that community. But we have contacted them and told them that we've got resources through this grant that will help them obtain the services of a designer to evaluate the problems there and to design a fix for it. And then if they're able to work on that, then we'll try to see if we can even find additional funding to help them actually make the repairs. So we're making progress, but something complex like that takes a little bit more, takes quite a bit of time, but our staff are working on it.
Okay, thanks, Art.
Okay, thank you, Vlad. Appreciate that presentation. Let's go to item 5, Board of Health members, health-related activities and accomplishments. Commissioner Edwards, you're up first.
No, I haven't had any accomplishments that I'm aware of. I just hope everybody's staying healthy and surviving through our COVID situation. I'll let it go at that. Thank you.
Yep, Commissioner Mejia.
Nothing really to report.
Okay. The only thing that I can report is the naloxone training that I did that was given a couple weeks back, and that was good because it coincided with our International Opioid Awareness Day, and we're having more and more overdose stats are concerning. So that was a good activity. And with that, I will go straight to the health officer's report. Dr. Abdulmalik is with us.
Good afternoon, commissioners. We are continuing to see high levels of community transmission of COVID-19, with our cases being 479.3 cases per 100,000 over the past 14 days. We are continuing to see outbreaks as well throughout our community and increased cases where folks are together. I would just like to take this opportunity to remind everybody to wear masks in indoor public spaces, maintain distance, and to consider wearing masks in crowded outdoor public settings, especially when distance can't be maintained. We are continuing to see our vaccination rates for COVID-19. We are seeing continued demand for our COVID-19 vaccines. To date, more than 170,000 people here in Thurston County have initiated vaccine, and more than 150,000 of Thurston County residents have completed a vaccine series. So this means that 68.4% of our 12 and up population has had at least one dose of a COVID-19 vaccine. While we've all been fixated on COVID, there are other vaccine preventable diseases. Thurston County Public Health and Social Services will be holding 4 childhood immunization vaccination events on Saturdays throughout September and October. So the first one is September 18th in Olympia at North Thurston High School. The second on September 25th at Rochester Middle School. The third on October 2nd in Yelm at Yelm High School. And then the 16th of October, again at Olympia at North Thurston High School. There is no cost associated with these immunization events, and immunizations will be available both for school required immunizations, as well as HPV and the meningococcal vaccine. Of course, Pfizer will be available for those 12 and up at these events. In terms of looking a little bit more globally, we continue to have an advisory for Long Lake due to an algal bloom and increased microcystin levels. We continue to monitor those levels weekly. And I'd like to just take this opportunity to remind Thurston County residents not to drink lake water and avoid contact with lake water that has algae in it and keep pets away from the algae, as well as avoiding eating fish from the lake, and to avoid areas of scum when boating. Overall, in terms of our other disease control and prevention work, we have investigated 96 confirmed and suspected cases of diverse communicable diseases, including Campylobacter, Cryptosporidiosis, Giardia, gonorrhea, hepatitis C, B, and D, Lyme disease, pertussis, salmonella, and shigatoxin-producing E. coli, as well as vibriosis, just to name a few. And we continue to provide direct observed therapy to folks here in Thurston County with active TB disease. In terms of what we're seeing overall, is we are seeing an uptick in viral respiratory illnesses consistent with what's being seen across the country and around the state. There have been reported cases of RSV and influenza A in our community. However, we have not had any lab confirmed influenza deaths or outbreaks to date, but we are watching that situation carefully. One of the things that's not, that makes this year different from past years was the significant decrease in respiratory viral illness transmission with all of the COVID precautions last winter. So we're watching carefully, and just want to let everybody know that while if you do have symptoms of COVID-19, definitely get tested for COVID-19 and follow those precautions, but that wearing masks, hand washing, and distancing, and the things that we've been doing are also protective against other viral illnesses that are circulating as well. And with that, I'm happy to answer any questions you may have. Thank you.
Commissioner Edwards?
Anything new at all on credit for recovering from this COVID-19 as far as treating it to be similar as a vaccination?
So at this time, if somebody has a confirmed COVID-19 infection, the risk of reinfection is low within the first 90 days. And that was based on looking at antibody levels. If somebody does not have COVID-19 symptoms and is a close contact of someone with COVID-19, as long as they remain asymptomatic, that risk of transmission is thought to be low. And there isn't quarantine guidance for that person as long as they are asymptomatic and within that 90-day period. Something that we are realizing is that while rare, reinfection of COVID-19 within that 90-day window is possible. So when there's that suggestion, so somebody who tests positive for COVID-19 gets better and then has another viral respiratory illness within those 90 days, we do look very carefully to see if there's the potential for reinfection. But so far that has been rare, but not impossible.
How about on, there's been some information that the asymptomatic breakout individual is more likely to spread virus than someone that's not. Does that make sense to you, that when they're asymptomatic, but they've had the vaccination, but then they come down with it, that they're still asymptomatic, that they give out more viral spores, or however you refer to that? Is there some, what's that about?
So that specific thing I have not heard. What I have heard with the Delta variant is that the time between when somebody is shedding virus until they develop symptoms is a bit longer than with previous variants, and that the majority of transmission does occur in that pre-symptomatic period in some cases. We are still, just transmission dynamics definitely change. In terms of people who are vaccinated, they do have an increased risk or an increased likelihood. So this is the pro and the con of vaccination. They have an increased likelihood of being asymptomatic or minimally symptomatic when infected. However, I have not heard any information leading me to believe that they are more infectious. In fact, the CDC has found that because their immune systems are primed to fight the virus, that the total duration of the infectious period is on average shorter than those who have not been fully vaccinated and haven't and their body hasn't seen the virus before. So that's I'm not sure if that answers it. I'm happy to answer anything else.
No, that's fine. Thank you very much.
Commissioner Mejia. Can't hear you.
I have no questions at this time.
Okay. I got a couple of random questions, Dr. A. Something that I heard kind of, I think earlier maybe in the vaccination time frame was that the more people we can get vaccinated, the better chance of like the virus not mutating, like it would have less chance to mutate. And I understood that it went back when we thought that, we were hoping that vaccinated people couldn't contract and spread. That turned out to not be true. So I'm wondering now, given where we are now, is there still an argument? Because I heard it again on TV and I was thinking, is that still true that the virus is less likely to mutate the more people we can get vaccinated, given that vaccinated people can still contract it or carry it or spread it?
So
how would that work?
Definitely. So actually, some of the recent data that the CDC released showed that vaccinated people are 5 times less likely to become infected. So there's definitely a risk reduction there. When I think about the variants, I think about the problem of having millions and millions of people get infected around the world. So a lot of the variants that are here had their origins in other parts of the world. So when we're thinking about the number of folks that would need to receive a vaccine or at least a dose of an effective vaccine, we should be thinking globally as opposed to locally.
Okay, so it's still a fair statement to say that it will hopefully more vaccination will reduce mutation and further risk of different variants, just to summarize.
Yes, but it's not enough to just do, we see significant benefits in terms of our personal health as well as the health of our communities when countries are able to provide significant doses of effective vaccines. We will likely see the most benefit when everyone has access to at least a dose of the safe and effective vaccine, thinking worldwide.
My second question is about schools, and you mentioned the vaccine requirements because there are certain vaccines that are required for schools kids, but the kids over 12 are not required to have a COVID vaccine. Is that correct?
That's correct at this time, yes.
And is there, given that it's been FDA approved and we have, like, as you point out, many other vaccines they have to get, I think there's 4 of them, right? To enroll in school, is this on the table right now? Is something that the state might require or that you've heard discussion about requiring kids at school to have the vaccine over 12?
So I know that it has been a conversation, but I haven't seen anything concrete or any concrete proposals at this point.
Just the employees?
Yes.
Okay. That's all the questions I had. Then we'll go, thank you, Dr. A. We'll go to the director's report. Ms. Shelley.
you so much. Good afternoon, commissioners. As always, I want to say a special thanks to all of our staff that presented the proclamations today and the members of the public and community that participated. That's always very meaningful for us, and we really appreciate it. This month has been an extremely busy month for us in public health, both with our COVID-19 response, as well as all of our regular foundational public health and social service activities and programs. I wanted to just share a little bit to tag on to what Dr. Abdamalik shared regarding our upcoming vaccine clinics. We strongly encourage people to please get their children vaccinated. For adults, to please make sure that your vaccines are up to date and get your seasonal flu shot. We do anticipate a active flu season, and immunization is one of the best tools that we have to prevent serious illness and death, and we hope that people will take advantage of that. We are planning to scale up for mass vaccination COVID-19 efforts for booster shots, as well as pediatric COVID-19 vaccines when they become available. We are in great need of medical volunteers as well as staff for our temporary positions to help us in this vaccination effort, and encourage anyone in the community, regardless of whether they have a medical skill or not, to please sign up at unitedwayofThurstonCounty.org to help support our upcoming vaccine efforts. Our COVID-19 business team has also been very busy over the last month. There has been lots of frequent changes to the guidance at the federal, state, and local level, and our team provides technical assistance to businesses, schools, childcare centers, and others to help answer questions and respond to complaints. In August, they had 36 different inquiries regarding things like college opening, outdoor events, masking at businesses, employer cases, and outbreaks. And our team is happy to go and advise local businesses and facilities on how they can prevent COVID-19 from impacting their workplace and helping to respond when there is a positive case, which when we have community cases at the level that we have had, and our test positivity rate as high as it currently is, that is bound to happen. And so we are happy to help. We also want to remind businesses and employers that they have an obligation to report any positive cases of employees to our department, and they can do so by leaving a message at our COVID-19 Public Health and Social Services line, which is 360-867-2610, and strongly encourage everyone to please stay home if you're ill, participate in your employer's health screening, and please get tested if you experience any symptom of COVID-19. Our community-based testing team is standing ready to help, and we have vaccination clinics offered by Thurston County Public Health and Social Services 7 days a week at multiple locations, including at Capitol Mall. So moving from COVID-19, I want to share some of our prevention efforts in other programs. Our staff have continued to maintain their efforts to support youth substance use prevention, our CPWI coalition. We have our Tumwater Hopes coalition that trained 20 elementary school staff at Peter G. Schmidt Elementary in the Good Behavior Game program. And we also kicked off the development of a youth coalition for Tumwater and did outreach at Tumwater Farmers Market Kids Day. So the Be That coalition continues to meet and offers training in a culturally responsive manner. Highly encourage people to get involved in that in Tumwater, as well as other areas throughout our community where our network is engaged. And you can find more information on our Thurston County Public Health and Social Services website about upcoming trainings and meetings regarding our coalitions. We are also prepared this last month with our back to school support through the Healthy Kids Safe Streets Network to provide information on active transportation to school and safe walking routes. So we encourage families and kids to take advantage of the great sidewalk system that we have, to wear a helmet while they are biking and participate in our programs to help educate kids on how they can safely walk and bicycle to school as an alternative transportation method to riding a bus. So this is also a time of year in the fall where people often are planning to put pesticides on their lawn to prevent weed growth in the future, and this can have negative impacts on our environment in multiple ways. Our staff continue to work at our retail garden center stores in educating the staff of those facilities on how they can provide information to their customers about choosing safer products in our community for their lawns through our common sense gardening and integrated pest management programs. We've distributed over 22,000 guides and publications over the last couple of years on this, and please check that out. We strongly encourage it. Our environmental health solid and hazardous waste program has also been working hard to make sure that our students have a safe start to their school year. And that includes things like making sure that our high school chemistry labs are safe and know how to properly handle and dispose of dangerous chemicals. Our solid and hazardous waste program staff worked with Oakville High School and stand ready to help other high schools in making sure that their laboratories are safe and that there are chemicals removed from the classrooms, such as metals that ignite when exposed to water, corrosive liquids, flammable, highly toxic chemicals, things like that. So we want kids to have a safe experience to learn about science in our local schools. And that's just one example of how our solid and hazardous waste program staff support our local community. So I also want to share that our opioid response program under the current Board of Health declared opioid crisis that we are undergoing in Thurston County has been very busy since the board approved our updated opioid response Thurston County plan last month. They have been working hard to educate local businesses and agencies about how they can post a naloxone cling on the windows of their businesses to show that they have naloxone available on site at their business. And most recently worked with Healing Hearts Ranch in Olympia as a first location to start piloting this great program. We continue to offer opioid overdose education and naloxone rescue kit trainings to multiple organizations, including right here at Thurston County. Thank you so much to the Thurston County Commissioner's Office that participated in the most recent training, as well as City of Olympia ESD 113 and the Olympia Academy coming soon here. The City of Tumwater, City of Olympia, and others all participated in our Opioid Awareness Day proclamation on the 31st of this last month. And we hope that those efforts will help to prevent unnecessary overdose deaths due to opioid misuse now and in the future. We do have pregnant and parenting resource materials available in both English and Spanish for the community regarding the dangers of using opioids. And our syringe services programs continue to be in very high demand. During this first half of the year in 2021, the average number of encounters was 225 people each month. And that is up from an average in 2019 of 190. It remains to be seen whether that is due to COVID-19 or not, but our opioid response program has continued to be active throughout this pandemic because this is very important to our community. We offer case management and testing services at our downtown Olympia Beach Clinic location and have 17 participants active in our hepatitis C program and administered 29 hepatitis C and HIV test sites at that location. So we are happy to help members of the public with any public health need they have at our Lily Road location or any of our satellite sites, including our syringe service program. And another thing that you can also get both online or at our Thurston County Lily Road site is a birth and death certificate. Vital Records is a foundational public health service that we provide at PHSS. And in this last year, we have administered over 520 birth certificates and 855 death certificates. And there are many more exciting things that we have been working on. Our staff has been working incredibly hard to make sure that our community is safe, healthy, and protected, and encourage people to follow us on social media or check out our website for other important program information and upcoming events and activities. And with that, I'll answer any questions that the board may have about my report today.
Mr. Edwards?
No, sir. I'm good. Thank you.
All right, Commissioner Mejia?
I had a question and I did not write it down. Now it escapes me, so I'll save it for later.
We know where to find Shelley.
Yeah.
Happy to answer any questions that you come up with later.
On birth and death certificates, is the scope of your service like people who are born or die in Thurston County, or do you have access to some kind of state? I don't know how that works.
We do have access to state vital records. So anyone in Thurston County can come to your local health department and request a record of your birth and death if you were born in Washington State.
In state, okay. That's interesting to know. Okay, County Manager, anything for Shelley?
No, sir. Thank you very much.
Okay, I thank everybody. I think we've got it done, and it's just before 5, which is great. Thanks everybody for their hard work today. And with that, we're adjourned.
Thank you.